Hey, welcome to the Birth Blueprint, where we will be discussing birth and maternal health care in pregnancy. My name is Chidera Chima, and in today's episode, we will be talking about early pregnancy and how to prepare and what to do in the first trimester. Next to me is Dr. Nicola Pemberton. To her left is Michelle Gabriel Caldwell, and asking all our questions is Rosemary Ozuna. Hi.
Hi, ladies. How are you?
Great, wonderful.
So now that we have a couple of episodes under our belt, how do you guys feel about the feedback that we're getting?
I think it's great. We really want to use this opportunity to give women all the information we can. We want to do it in a way that seems palatable, fun, but definitely still edifying. So I like this. I hope they like it too.
Do you have people coming up to you, Doc, and being like, "Hey, I saw you on the pod"?
Yeah, it's freaking me out.
Do you get it, Chidera?
Yeah, I've gotten positive feedback
Yeah.
about a lot of our patients who are learning more, so it's been good.
Michelle, are you getting a little more attention because you're like a podcaster now?
I would have to say, yes, I'm getting a bit more attention. Like, oh, you're so famous.
Oh,
I'm like,
man.
why, yes, I am.
So after these episodes, I did get a couple of questions. And because we're going to be talking about, preparing your body and first trimester, I feel like we could jump into some of the questions we got. So my first question would be, how do I prepare my body for pregnancy?
I think I'll take that only because one of the things I like to stress in childbirth education is really having a conversation about nutrition. First and foremost, just what are you supposed to be eating on a daily basis? What protein levels are you supposed to be hitting? What's your hydration supposed to look like? How are we balancing this diet together? Because a lot of people don't really know what they're supposed to be eating before pregnancy. So during pregnancy is always a mystery too. And I'd like to have people not kind of try to play catch up along the way and get them as early as possible for the best possible outcomes of the health of mom and baby.
So nutrition is a big deal.
It's the foundation to a healthy pregnancy.
Okay.
And secondly is exercising, movement. Like gone are the days of when, you're pregnant and you're supposed to just sit in a corner and, nobody touch you and look at you and all that stuff. Like you've got to move. One of the things I don't like are those parking spaces at like all of the grocery stores where they go, this one is for pregnancy. No, you park way in the back, all the way in the back, and get your walk in, right? Save that space for when you have the baby and you're bringing in all the crap into the store.
Awesome. And okay, so I have nutrition down and I'm working out or even just moving my body, right? Should I be taking supplements, vitamins, or should I wait until I'm pregnant?
Well, first of all, I want all of the vitamins to come from whole food sources first. And supplements are just that, supplemental, right? It shouldn't be, oh, I took my prenatal vitamin, I don't need to worry about what I ate. So I really want people to look at good whole food sources for their nutrition, number one. But of course, we hear a lot that individuals need to take folate. Folate's really important to make sure that we're mitigating neural tube defects. But I really want people to become readers of their vitamins. And we can have really great sources of vitamins where, they're not getting just expensive urine, but we also want to make sure that the body is actually absorbing all of this. And so there are a lot of chemicals that are a little bit hard for people to understand. But I think the first thing is to look at particularly methylated folate instead of actual folic acid, which is a little bit difficult to digest.
So folic acid is iron, right?
No.
Or what exactly is folic acid?
No.
Folic in your vitamins.
Folate.
Folate.
Yeah, it's a form of vitamin B actually, but it's, like I said, it's really about ensuring that there is a reduction of neural tube defects. There's a lot of other benefits. You can have to make sure you're taking B12, B6, and iron, of course, for proper absorption. All of these things have synergistic effects. So taking one, you need, a couple of the others. Why they're coming in a pill form that are combined. The others can come in. Like iron usually needs vitamin C for proper digestion. Sometimes you'll see them with rose hips or things like that. So, I could probably, talk for another couple hours about all of the vitamins and what they're beneficial for. But I think most important is really making sure that the baby is growing properly, and your body is going through a lot. You're not just growing the baby, you're growing the uterus, you're growing a brand new organ that you've never had before, the placenta, and you're actually growing amniotic fluid. So all of those things need to be in tip-top shape so that mom can be healthy for the pregnancy, also for healing afterwards. And if breastfeeding is her journey, you need to make sure that that's happening too. So this is why, nutrition is definitely the foundation.
Okay, awesome. So let's say I'm doing all of that. I'm getting my nutrients in, I'm eating well, I'm, moving or exercising. I'm trying with my partner for what seems to be a long time, and it's not happening. When do I go see my gynecologist? And is it just me that has to see the gynecologist? Is it someone else my partner? Like, what does that look like?
I think that's a great question. Honestly, I guess if you're just trying, it's one thing. But I think when you get to a point from a time perspective, if you have concerns that nothing is happening, then sometimes the consultation would be warranted with your GYN provider, which could be a gynecologist, could be a midwife, nurse practitioner. Usually we'd say for women under the age of 35, if they've been trying for at least a year and actively trying for at least a year, actively meaning they've been putting the effort in to try to be intimate during their most fertile period, they're actually moving things to doing certain activities to try to promote their fertility, even if it means from a healthy perspective, then you usually would say after at least a year's worth of trying, they should consider maybe evaluating if there is a reason for why they still haven't achieved pregnancy. For women 35 and older, we would usually say after 6 months of trying.
Okay.
But sometimes, a lot of times, the anxiety can start to kick in, and it just tends to have a negative effect, even physiologically. Any infertility specialist would agree that the anxiety just doesn't help the situation. When you do decide to come for that consultation, it shouldn't be just the female. She naturally would see her gynecologist and ask questions, but there's a lot of information that can be gleaned from just the female patient as well as her partner, if it is a male partner. And in that moment, you might be surprised by some of the things that might be happening in that time period that could be tweaked to see if it would improve their chances of achieving pregnancy.
Okay. And I find that I'm pregnant. Is a home pregnancy accurate? Accurate enough meaning I can go by that, or should I go and get blood work done?
You mean the home pregnancy test?
It's pretty
like at
sensitive.
home.
Yeah.
It's pretty sensitive to let you know that, hey, you have a
When
pregnancy.
should I call? When I find out I'm pregnant today, when should I call? 'Cause I feel like I'm gonna call right now, and I just found out I'm pregnant. When should I call, make my first appointment, or even to just find out, I guess, where I'm at in this pregnancy?
Times vary, but I would say a safe spot would be at least 4 weeks
After the missed period?
after
Yeah.
the missed period. One, to get blood work to just trend your pregnancy levels to see if the pregnancy is heading in the direction that it needs to be. And then, of course, to set up your appointment to schedule an ultrasound to see if the pregnancy is viable in utero. where we would like it to be.
And what does blood work tell you?
Well, I can tell you a few things. It does confirm, yes, that their urine pregnancy test is positive. A lot of people, I think when they're surprised they actually achieve pregnancy with home pregnancy tests, they like, no, I'm going to take another one, and I'm going to take another one, and I'm going to take another one.
Guilty.
And I usually say you could take 10 tests. If 9 are negative and you have 1 positive, believe the positive. Don't keep, going through the same thing. But at that point, if you do come and get blood work, it can give us, as Shadera was saying earlier, an idea of just the trend, if we're just assessing if the pregnancy is going the right direction, but the values can also give you an idea of maybe how pregnant you are. And again, it's a big range, but it kind of gives you an idea. And in that range of numbers, sometimes it will let you know whether or not anything could potentially be visualized on an ultrasound. So usually certain values we would see when it comes to pregnancy hormone levels, we won't expect to see anything on a GYN or pelvic ultrasound. So therefore, when we know we've achieved those levels, we may consider doing an ultrasound to assess if we're appreciating that the pregnancy is growing in the right direction based on just the numbers the pregnancy hormone is telling you.
So I'm calling 4 weeks after I find out I missed my period. So at that time, I'm assuming I'm 8 weeks, right? And I make my appointment. What does my first appointment entail?
So it's the new OB appointment, so you're starting from fresh, other than getting a pelvic ultrasound to kind of help date your pregnancy. We're kind of going through A to Z of what to expect throughout your journey, coming here for your visits, how to start on the right foot, preparing and making sure that each trimester is as proactive and healthy as possible. And then each visit is different. Of course, it's like information overload sometimes, so kind of reiterate each time you see a patient of what to expect the next time they're at their OB appointment.
And what should I be preparing? I feel like it's an early stage, right? Eight weeks is early, but what should I be doing at that point to prepare for my pregnancy? Prepare for this journey that I'm about to embark. What should I be looking for? What should I do? Should I sign up for classes, or should I, if I'm not sure which provider I'm looking for, what kind of birth I want, what should I be doing at this point in my pregnancy? Or is it too early to even do that?
No, I think research as early as possible is key. And to your point, thinking about what are my options, right? Where am I going to birth? How would I like to birth? Just getting as much information as possible. Am I going to do it without interventions? Do I plan to do that with, medication? Or just getting the information to help you make a decision as to what path you'd like to take. I mean, these are all kind of ideal preferences and to sort of shape the options, but really kind of understanding what they are before you can make a decision to go, this is just going to be what everybody else has done or what I've heard, someplace else. And, we like, obviously, for people to consider birth center birth because, that gives even more options than most people think about in a hospital setting. So, I mean, I think, going back to taking a class, getting to know what your body has to do during this process, having realistic expectations about that.
And do you have those classes before pregnancies, like what to expect in a pregnancy or things like that?
Oh yeah, right. So the childbirth education classes will really cover a lot of physically what's going on with your body during pregnancy, just what is happening during your gestation period. And really kind of going through just some comfort measures as well, right? There's sometimes, a lot of indigestion, some gas, maybe some anemia. There's just what other conditions might come up during, the pregnancy, we talk about, so people, again, can understand what that means. Is it going to change the trajectory of the labor or the type of pregnancy, the options that they want? And then how to shape those questions so that they can have very succinct conversations with their providers when they go to their next meetings.
And should I have a list of questions for your provider?
Always.
Yeah. Do you guys
Always.
appreciate those patients that come in just with their list of questions?
Yes,
Yeah.
because we know the pregnancy brain is no joke. And you're going to forget. Even if you had a list of questions in mind, by the time you get into the room, maybe, you're either excited or anxious about whatever it might be, sometimes those questions can just fly right out the window, and then you feel unsatisfied sometimes, leaving the prenatal visit thinking, oh, I knew there was something I wanted to address. And of course, nothing brings back the memory of what you wanted to know until you walk right back home.
Why do you get pregnancy brain? Why is that?
Oh my
And what's
God.
up with that?
Oh boy, you want chemical stuff? I don't know. I mean,
It's just, this is the one time I actually can blame hormones,
yes,
right?
That's
like
it.
normally I don't ever want to hear that.
yeah, never.
But there's obviously an influx of a lot of hormones that are just coursing through your veins, and your body's trying to keep up with all this brand new stuff and everything that it needs to do. And you have stem cells from the baby hanging in there too. Like there's a whole lot going on that's processing biochemically, and some of that's going to cross the blood-brain barrier
Yeah.
and make you
A little
and make you pause for a little bit.
So I get my first ultrasound, and that's dating my my baby, right?
Mhm.
Dating my pregnancy. What comes after that?
On the actual appointment day, or
For the next series?
For the
next
next. What is my next appointment?
So if you're talking about a scheduling, so to speak, your initial appointment could happen, give or take, when you first present in the first trimester, which is first trimester usually goes up to 14 weeks. We usually tend to follow up our patients early on in the pregnancy. It might be like a 4-week window. I mean, granted, of course, as long as everything is going within the realm of the pregnancy being normal. If there are conditions or concerns that are happening in that time period that might require like closer or more frequent appointments, and then we will, accommodate or change accordingly. But if everything is going within the normal schedule, you would say usually in the first 4 weeks, you will be seen every 4 weeks, so to speak, up until about the early third trimester, which will be around 28 weeks, which is usually at the time of glucose testing. In between that time period, you're being tested for, let's say, genetic screening, what people may understand as for Down syndrome, or other type of screenings that will assess for any concerns for brain or spinal cord function, things like spina bifida and other things like that. But by the time they get to the 28-week mark, then we're checking or evaluating for any glucose abnormalities, particularly diabetes screening. Once we hit that early third trimester around 28 weeks, then we're starting to reduce the time intervals, meaning we are seeing you a lot more frequently. We're cutting the time in half, so we're seeing you every 2 weeks. These are according to our American College of OBGYN guidelines, and I believe ACNM may be on board with the same. So after you hit 28 weeks, we're seeing each other every 2 weeks until around 36 weeks, which is when we do the last usually set of testing, repeating certain labs that were done, vaginal swabs or cultures if there's any concerns, and as well as particularly Group B strep, or GBS we might say for short, which is a bacteria that we might say ideally it doesn't affect mommy, but it can affect the baby if passing through the vaginal canal, and we want to know about its presence if we needed to, pre-treat any mom during labor to help reduce the bacteria to the baby. So once we hit that 36-week mark, then we would be doing a weekly countdown until the due date, and that would be pretty much the schedule for the most part.
So I come back at 12 weeks. It's 4 weeks after 8 weeks, and I get another ultrasound. That's testing for Down syndrome. What is that testing for?
You mean after 8 weeks, when you come back
You're-
4 weeks from
you're
that
4
time
weeks after
period?
that,
Yeah, usually the 12-week ultrasound would be what we call the nuchal ultrasound. What they're doing is measuring a fold in the back of the baby's neck. We call the nuchal fold. And usually in chromosomal concerns, particularly when you're dealing with trisomy 21 on Down syndrome. I don't want to get too scientific about it because it's going to get boring. But it's usually, we look for any increases in the growth of that nuchal fold. When we're doing that measurement, we also do blood tests as well to assess whether or not there's an increased or decrease. It doesn't mean yes you have it or no you don't have Down syndrome. It is, do you have an increased risk for it or a decreased risk for it? And that's what we're doing with calculations with the ultrasound, the measurement of the nuchal fold, and any additional blood tests coming from the mom.
Okay. And here's a famous question. You ready? When do I know the sex? I know you guys get that all the time, right?
All the time. Well, it depends. Usually, most moms who are advanced maternal age will get that testing.
Wait. What does that mean? Advanced maternal age. What are we talking about here?
Women who are over the age of 35 who are pregnant.
So we're advanced.
We're advanced, definitely.
A
We're
plus.
advanced.
Yes.
For advance.
We're amazing.
Oh, okay.
We're in the stratosphere of advancement.
Okay, that's
Yes.
cool.
Yeah, definitely not the
No,
geriatric
no,
part.
No big deal.
Yeah, no.
Not geriatric. I'd
No.
like advanced.
Yeah.
Okay.
No.
All right. Cool.
Advanced.
Yes.
You know, like advanced degrees. Like, you know, you're just advanced.
Yeah. We're a little more seasoned, right?
Yes.
Exactly.
Yeah, it's like a fine wine.
Yeah.
So at 35, when do I find out?
Usually at the nuchal point, so at 12 weeks when you would get the nuchal ultrasound, we coincide that testing with what we call the NIPT, which is the same testing that Dr. Pemberton was talking about. It just goes more in depth, and it also can offer gender screening.
So if I'm under 35, do I get the same?
No, usually you would find out the gender closer to 20 weeks when you get your anatomy ultrasound.
Why is there a difference? Why do your advanced mother get it and your non-advanced moms won't?
Don't get it? Good question. The testing, the NIPT, because it's a test that goes more in depth to look at more chromosomal abnormalities that women of higher age may be more prone to than if you were younger.
Okay, that's cool. I mean, I guess it has its perks, right?
You get to do your
On
gender
some
reveal
levels.
earlier.
You get to do the gender reveal. So at that point, at 12 weeks, we talk. When do I talk about what my birth plan would be? Would it be as early as 8 and 12 weeks, or would it be later on when I guess I'm cleared for whichever type of birth I can have?
That birth plan can be just an ongoing conversation. You know, it's not just a piece of paper. It's a continuous conversation with your providers, with your partner, with the rest of your birth team, and anybody else who's involved. If you have to go to maternal fetal medicine or things like that. So all of this is just helping shape what ideals you may have for your birth, and then you're correcting or adjusting along the way. It should be kind of a living document, not kind of a stamp.
Yeah.
So it really has to evolve based on what your health conditions are like in the moment. And, sometimes people, once they learn more too, they're like, oh, I thought I wanted an epidural. No, I don't want one. I really want to, have this labor naturally. So it can shift and change, and it should shift and change. It should
You can
never.
edit it.
Yeah,
basically,
absolutely.
right? You just edit throughout your journey.
But it's nice to start having that conversation with yourself and your partner and your doctor as early as you want to.
And Dr. Pemberton, question for you. What causes nausea in the first trimester?
Oh my
so
Lord.
much.
Why?
Do it straight
Like
for the
straight
juggler.
there.
For the juggler. Go ahead. HG and why?
More than likely than not, I would tell my patients the cruelest, and I say absolute cruel way for a pregnant woman to know that she's, let's say, hungry is through nausea. Most times when we're not pregnant, we're like, hey babe, I'm gonna go get something to eat. I'm really starving. And let's say you're circling around trying to find parking for this fancy restaurant, and you're gonna be like just, oh, I'm really so hungry by the time I get there, but you will be fine. When a woman's sugar drops as a result of that time that has passed from her last meal to the next meal, her body interprets it as you need to eat. But instead, it manifests as,
Nausea.
which is cruel. And the most time that you will tend to see that sugar drop is during the course of the night. So you go to bed and then you wake up. If you were sleeping for a good portion of the night, you wake up and the first thing you want to do is pray to the porcelain god, which is why they call it morning sickness, because that was when your sugar is at its lowest. So certain gag reflexes are going to be increased when you brush your teeth, and if you have nothing to eat, the first thing you want to do is just, either be nauseous or unfortunately end up, having it, vomiting. So those are things that we keep in mind when it comes to a pregnant woman being on top of those symptoms in the first trimester. It's making sure you bring snacks, healthy snacks, whatever it is. And sometimes it's Russian roulette with what you eat. Sometimes you say, this day it was great, and I tried it again the next day and it was like, no bueno. Everything came right back up. It is trying to eat within several hours. It's not waiting and doing breakfast, lunch, and dinner, or doing breakfast and dinner, or some people go, I don't eat breakfast. None of that. Your body will retrain you. And it's letting you know from a metabolism standpoint, I need this. But if you don't give it to me, these are the consequences. So we don't say you're going to eat a lot. A lot of people have a misunderstanding of, well, I'm not eating the same. You don't have to eat a lot. You just have to keep a little down what you eat. Your baby's getting it regardless, but it's not, I'm going to sit down and eat the same amount of food that I would have eaten when I was not pregnant, because your body just doesn't want to tolerate a whole lot. It just says, I need a little bit. And then you might need a little bit again in 2 to 3 hours, and a little bit again in 2 to 3 hours. So you got to retrain your brain as to, I'm not eating a lot, but I'm trying to get what I can in and keep it down.
What is this myth that I feel like women eat so much during pregnancy? What is the extra amount of calories we should be taking in when you're pregnant? Because some women, I feel, gorge, right? Like, because I'm carrying another
Well, you're technically not eating for two.
Yeah.
Right? So that's a huge misnomer. And, to Dr. P's point, it's definitely about changing and shifting how you eat and your relationship with food, because this is honestly the conversations that I need to have with folks is you can't skip and not eat something for 17 hours and then
but I can't make it up later.
Think you're gonna gorge. Yeah.
Just get like
but
a
you're
whole big meal?
you're just not gonna feel well if you do that. So it just maintaining proper sugar levels is definitely eating every 2 to 3 hours, not having that big, huge meal that you had before, because now your body's making more acid to actually digest this meal, and that's also going to get into like heartburn and all these other things that are just going to make you miserable. So honestly, thinking about what is your norm, I always tell people to journal what they're eating. Write down so you can see what you have and what may have been bothering you this day, and try to avoid it, or go back to it and see how is it really driving you nuts. I'm not a big stickler for a specific amount of calories, because everybody starts off either on weight, underweight, overweight during their pregnancy. So I can't say, you got to have an extra 500 calories a day, because I don't know what you were eating beforehand.
Correct.
So it's always going to be about what are you eating now. Take a balance and look, and when we focus on how many grams of protein you're getting a day, how hydrated you are, how many servings of different vegetables and things like that. I don't have a whole lot of conversation about carbs because we're very carb heavy
Yes.
eaters.
But it's also a very comfort food, especially in the first trimester. So you might find with the nausea and vomiting, you might say, well, I'm already pretty healthy and I eat a lot of vegetables, but I can't tolerate it. I think chicken always gets a bad rap.
Smell.
Such a bad rap.
Yeah.
The smell of it.
Yeah.
Oh my God, the taste of it. Just get that away from me for some reason. And some people who were never really meat eaters will say, why am I craving beef? This is doesn't mean.
Why do you crave things during pregnancy? And I was fancy. I wanted.
You were fancy.
I wanted the oxtails. Talk about.
Going for the most expensive.
Very, very sophisticated. You know, your body, you crave what you want because you're hungry for it. You know, it only becomes an issue if it's like a pica, you know, and you're craving like weird stuff,
Right.
like soap or
Baby formula.
yeah, like just
banana.
bizarre.
No, banana's fine. It's food.
Yeah.
Pica, what Michelle is describing is eating or consuming things that is not food.
Yeah.
So back in the day when they used to find women who were diagnosed with pica, they would find them in their gardens eating dirt.
Eating dirt.
But there's iron in the dirt.
Right.
Or they'll eat their baby's formula powder, just putting it in there, like it was like, yeah, this is amazing. But
That's
there's
an extreme
iron,
deficiency.
yeah, but that's iron in the baby formula as well.
Wow.
I mean, more unfortunately now we see ice. That's the biggest thing.
ice
It's
is
ice.
Yeah.
But your body's saying, I crave something, but it is, what I'm craving is not food, and what I crave is what I need. You know, it's like that deficiency is, I'm missing something right now. Whether it be what I'm putting in, what I'm consuming, my body says I need something, but I'm not, unfortunately, sophisticated enough to specify that it's maybe iron I need, maybe some supplements, some vitamins, some minerals, things that I'm lacking, whether it be in my diet or otherwise, or if I'm not taking my prenatal vitamins, I'm missing things. So then you might crave things that are not necessarily what your body should have.
But how does your body even like, hey, that dirt looks good?
It-
Or how does that formula must be great? Let me try it.
It
Like, I
just
don't
it
know.
manifests
It's
itself.
the same thing
that
like people
way.
do with
Yeah.
pizza, or you know, they know they shouldn't eat pizza because it could cause them heartburn, but they just gotta have it.
Slice after slice.
Yes, until they go like, I'm having a heart, my heart, oh, it hurts. You know, I'm
Yeah.
like, that's heartburn.
Yeah.
You know.
Okay. And so last question. We were talking about prenatals. How do you feel about the gummies?
The gummies don't typically have iron in them.
Over the counter ones,
Yeah.
they don't. So usually you would require some form of iron supplementation as the pregnancy progresses, because the baby is going to say, I need more. As baby grows, and naturally so, I need more. You have to give it to me. But if you don't give it to me, I'll still take it from you. And as a result, and I'm trying to make the baby sound like a parasite. That wasn't the goal.
Your baby's not a
But
parasite.
that wasn't the goal. But the thing is, your baby's gonna say, I have to grow. I need what I need, and I'm gonna get it from the source. But if you're not giving it to you, it's hard to give to baby. Baby will still take it from you. So then you start to become deficient
And you're
in
deficient.
those things. And so with gummies, granted, it works well first trimester if you can't tolerate a lot and you say, this is the best I can do to get iron. I can't swallow pills, or maybe the pills are too large for me, or just drinking water or any liquid. It's just maybe more perturbing because of some of the early trimester or first trimester symptoms. You might be able to still give what you need. Not a problem, but you have to be mindful that there's a good chance you're going to need some form of iron supplementation as the pregnancy progresses. And usually we will find that out usually around the early third trimester when we're checking for anemia at that time.
Okay. That's great. Well, thank you, ladies. I appreciate all that information, and I can't wait to see you for the next episode.
Okay, fantastic.
Well, thank you for joining us for another episode of our podcast. This was fun. Please like and subscribe on YouTube. Leave your comments on our Instagram. If you have any other topics you would like to hear, let us know, and we'll see you next time. Thanks, ladies.
Thank you.
Yeah.
It was great.
Thank you.